Hi, it's Dr. Robert Brueck coming to you with another segment of What's New in Cosmetic Surgery. We're going to talk about a lot of exciting things, and again, if you want to contact me at 239-244-2329, you can leave a message on my website, Beauty by Brueck. You can call me and request a complimentary consultation, or if you have a question or you want me to do a little research on your behalf, I'd be more than happy to do it. First thing we're going to talk about today is fat grafting. You know, fat grafting is becoming extremely popular. We're utilizing it more and more. We're using fat like in facelifts 60% of the time. I utilize fat. Breast reconstruction, I'm doing more and more implant exchanges, putting fat in there to take away the implants, using fat around the implant to make it look more natural. But one of the big questions in reconstructive surgery was, does the presence of fat grafting increase the recurrence rate of women who've had a mastectomy because of breast cancer? There was a study done out of Houston where they followed 1,000 women for 5 years. And the idea was, does the presence of fat grafting increase the recurrence? The good news is it doesn't. So fat grafting is a great tool, it's a great adjunct, and certainly we're going to hear more about it in the days to come. Also, there's a new kid on the block. You know, it seems every time we turn around, we got a new laser. We're going to talk a little bit about this new toy in our office. But this is called the B-Light breast implant. One of the problems, women come in and they want these huge implants. Well, a 500, 600, 700 cc silicone implant is pretty heavy. And you consider you carry that around all day, you don't wear a bra, it stretches the ligaments, the collagen thins out, it attenuates, skin envelope stretches, and there are a lot of complications and sequelae for people that have large implants. So now we have the B-Light. Now, it's not available in the United States. It's available in Europe and in Israel. It was developed in Israel. And what they do is they use these boro crystals, silicate crystals, and mix it into the silicone. And these are like little microspheres. And what it does is that the weight of a corresponding implant between silicone and the B-Light is 30% less with a B-Light. So you could have a 400 cc implant of silicone, 400 cc implant of the B-Light, and the B-Light implant will be about 30% less in weight. So for those women who have neck, back, shoulder pain, that have breast implants or thinking about it, you might want to consider the B-Light, but unfortunately you have to go to Israel or Europe to get it. Not a bad idea to take a European vacation. Next thing I want to talk about is our new toy, Sculpt Sure. Light-based way to remove excess body fat. What's great about this, it's outpatient, 23 minutes, no downtime, no injections, no local, no cream. There's a treatment head, and there are 4 treatment heads. So you can treat 4 areas at one time. So for example, one above the belly button, below laterally. Great technique. And there's a cooling head, so it cools the skin, the laser's turned on, it treats the fat for 23 minutes, fat cells break down, and over the next 6, 8, 10, 12 weeks, the fat layer is reduced. You can get reduction of up to 20 to 25% of the fat layer with one treatment. Good news is, if you want more, come back for a second treatment. So you're going to be hearing more and more about this, and this should be ready, up and running in about maybe a couple weeks. And I'll send out an email blast. It'll be on the website, so you'll get to know. Next thing I want to talk about is synergy. You know, you help me, I help you. Well, now there's a study that tested the synergy between Botox and fillers. And what they found that is if you put a filler, Juvederm or Restylane, into an area and then used Botox along with it, the effects and duration of the filler was increased. So for example, people want to fill in some lines here, wrinkles, whatever. You do Botox, you do the filler will last longer because you've paralyzed the muscles and prevented the contraction. Makes sense. So there's a little synergy between the two. Another thing I want to talk about, facelift complications. Many times people come in when we talk about facelifts. I do a lot of facelifts. They ask me, what are the risks and complications? You know, there's bruising, swelling, infection, bleeding, scarring. It's part of any operation. But there are about 125 to 30,000 facelifts performed on average per year. That's a lot. Men and women both. And the overall complication rate was just 1.8%. And of that, the 2 most common complications are hematoma, which is bleeding, and 2, infection. Now, I can't really recall an infection in the last several years, but sometimes you get hematomas, which is abnormal bleeding that sometimes requires going back to the OR and relieving the bleeding or the hematoma. It's more common in men than in women. Men have thicker skin, and because of that, a more luxurious blood supply, therefore bleeding is more common. But that being given, men age better in that their skin is thick. And I think one of the aspects is, like, for example, I get up in the morning and I shave. It's sort of like a mini microdermabrasion every day. So I think men age better just because of the thickness of the skin, which is more resistant to the sun, and the shaving. So the overall complication rate is 1.8%. Number one, hematoma. Number two, infection. Another common thing that I need to discuss with people is don't smoke. Smoking is the death knell of any cosmetic procedure. Facelift, tummy tuck, breast lifting. I tell patients don't smoke 2-3 weeks before, 2-3 weeks after. Ideally, you won't be a smoker at all. But smoking really enhances the effects of infection, wound breakdown, skin slough. It's a nightmare. So do yourself a favor, don't smoke. Now the question is, as popular as facelifts are, so are liposuction, probably even more so. The question is, are people satisfied once they get liposuction? Well, there was an interesting study done where they took about 1,900 patients and they divided them into two categories. Those that had a BMI, body mass index, greater than 30, i.e. they were obese, and those that had 29 or less, i.e. overweight or normal. And they found that the satisfaction rate was the same. But a comment is, you need to understand that this is not a substitute for weight loss. You have to go ahead and you should have areas of fat that are disproportionate. Liposuction is a great way to do it. But you're not going to take 300 pounds, lose 100 pounds through liposuction and feel like $1 million. So the satisfaction rate was pretty much the same. Now, one of the things that we see occurring throughout our country is consolidation. This bank buying this bank, this industrial complex buying this. Well, the same thing is going through in the cosmetic industry. Allergan just bought a company called Anterios, A-N-T-E-R-I-O-S, and I believe that's how you spell it. They have developed a transdermal system to deliver Botox. So in the future, you may not have to go to your doctor's office to get shots. You may just need to go there and get a script for a Botox cream that people can apply to different areas of the body or the face where they want to have the effects of Botox. So it's a transdermal delivery system for Botox. Exciting? Who knows? How soon? Who knows? But again, I want to say thanks for tuning in and listening to us. And again, if you have questions that you'd like me to research or answer, you go to my website, Beauty by Brueck, and contact me. Or call me at the office, 239-244-2329, 244-2329. And again, if you want to just come in for a complimentary consultation or a second opinion, maybe even a third or fourth, feel free to come in, utilize my 37 years of experience. Again, I want to say thanks. Hope you have a great week. God bless each and every one of you.